Good morning. I want to thank everybody for coming. I know it's been a little while since we've had you out, but we've really been working hard on our pathway to recovery and stay on top of this. So today we are going to talk about a testing opportunity that we have. And I'm going to stick around and answer any questions at the end, but for now we have very talented folks up here. I want to go ahead and turn it over to Commissioner Naft at this time.
Thank you very much, Chair Kirkpatrick, and thank you to our friends in the media for helping us get the word out about this important opportunity. We're all here because we want to get our community back open. We want businesses to be jump-started. We want visitors to continue to come to this fabulous destination, and we want to do it all safely. And the way that we feel and the international community feels is the best way to do that is by testing as much as possible. And that's why I'm so grateful to the chairwoman for working with our federal partners, working with the White House and the Department of Health and Human Services, and having the foresight several weeks ago now to put in a grant to request 60,000 tests for this boost, this incredible, unprecedented boost in testing opportunities here in our community. So that's what we're pleased to announce. It's going to be called Stop, Swab, and Go, and that is 60,000 COVID-19 tests that are coming to our community to be used over a 14-day period. So we're boosting our sites that have the opportunity to get tested. The first step for our community members to do is go to doineedacovid19test.com. I was on it this morning. It's a very simple site. You plug in your information and you can participate in some additional testing opportunities using those 60,000 tests through the Department of Health and Human Services. Those locations are going to be at the Fiesta Henderson Hotel and Casino, Texas Station, and Sam Boyd Stadium, and that's in addition to the testing locations that this partnership and this collaboration already has. I want to thank, I know you're going to hear from Chief Steinbeck, but his firefighters and his entire team through this pandemic has been incredible, out in the heat, working really hard to make sure that the logistics happen as smoothly as possible. And that's a collaboration too with the National Guard, whose men and women have been unbelievable in this partnership, along with Clark County, who has, under the chair's leadership, taken the extraordinary lead in COVID-19 tests. So we want to encourage everybody to do that and just highlight the true partnership that this community is offering to bring these 60,000 additional tests to our community. I also want to stress that these tests are for those who are symptomatic and asymptomatic. If you feel like you need a test, if you've been around somebody who has tested positive, don't be shy, don't be bashful. Come on down to one of these locations and stop, swab, and go. These additional locations are also going to have drive-through opportunities, which we know are so popular and have been popular throughout this entire 5-month period. So I appreciate everybody helping us spread the word. 60,000 tests is a lot to administer in 14 days, and it could not be possible without Chair Kirkpatrick, the Southern Nevada Health District, Clark County Fire Department, and now I want to introduce our friend, Councilwoman Pamela Goins-Brown from the City of North Las Vegas. Councilwoman?
Good morning. Thank you to the county and the health district and all of our partners for making this expanded testing happen. As the largest majority city in Nevada, this additional testing is extremely crucial to understand why the spread of COVID-19 is happening in our community. Looking at the cases in the city of North Las Vegas, we have the second highest number of positives, and 3 of the 8 most impacted zip codes are right here in the city of North Las Vegas. So we know that according to the CDC, if you are African American, you are 5 times likely to be hospitalized, and if you are Hispanic or Latino, you are 4 times more likely to be hospitalized than if you were white. Those are staggering statistics to me. During the first wave of the pandemic, 2/3 of the people who died in North Las Vegas tested positive and also succumbed to COVID-19 virus, and they were African American. Extremely alarming to me as well. So I just want to stress how important this is to get tested, and more importantly, the testing is free. costs you nothing. So I want to encourage all of our citizens across the entire valley to make sure they take advantage of this testing that's going to happen across the valley. And with that said, I'd like to go ahead and turn it over to Chief Steinbeck, Clark County Fire Chief.
So testing has obviously been one of our very top priorities. It will continue to be so, to be a top priority for us. We have the community-based testing that is continuing and will continue through this process. Those are the two sites that are opened up at Cashman and at UNLV. And I want to thank them for their, thank our partners for those sites. Those will continue to be open and are still available. I know we're highlighting this blitz, we're calling it a blitz attack for the additional testing today. And that's going to be a great surge of testing capacity for us here in the Valley. One thing I want to highlight is that, and thank you to the chair, is that we're the first community, at least this is what we've been told, that has actually asked for this resource to come in. The other places this resource was automatically dispatched out by Health and Human Services and the White House. But that's just how proactive the leadership has been to try to make sure that we can identify as many of the people that have COVID-19 as possible and isolate and to try to get this reduced in severity in our valley as soon as possible. It does take a great partnership, and I want to continue to thank the National Guard. I want to continue to thank our cities and some of our private partners that are assisting us with this. You will sign up at the website, and you will get a time there at the website, and that is your best way to go ahead and get the test. Now, of course, we have the website for UMC that you could continue to get the test at Cashman and also at UNLV. But to sign up for this additional testing, which is completely free, let me read that website to you one time here, please, is at www.doineedacovid19test.com, and that's on the news release as well. I also want to stress, if you don't have an appointment, we will take you there as well. We want to get these tests done. Now, obviously, an appointment's going to get you through faster, but if you feel like you have been exposed, you feel like a test is very necessary for you, go down to the sites and we'll get you through. We have this increased capacity and the confidence that we're going to be able to facilitate for everybody that comes down. So we're looking forward to this, and we're grateful for all the people that have helped to make this happen. And I'll be standing on the side here for any questions. Thank you. Oh, excuse me. I got to introduce my good friend, Dr. Lagan here, who has been working day and night. Appreciate it. Thank you.
Thank you. Good morning. Good morning, and thank you, Chief. First, we want to say how pleased we are with this initiative, because in addition to all the testing that we have been doing here in Clark County, now we have an additional 60,000 tests to offer our community. I also want to say, and I actually repeat, that testing is offered to everyone in the community, regardless of signs or symptoms. So you don't need to have any cough, fever, or respiratory symptoms of any suspect of COVID to actually go to the testing site and be tested. Something important about testing, and we want to emphasize that, is that sometimes a person might have a negative test, and it is reassuring for that person, But also, we have to keep in mind that if a person has been infected with COVID, the person might actually be negative the initial 2-3 days after infection. So if somebody has been recommended to stay in home quarantine because of recent exposure to COVID, and they have a negative test, still that person must stay at home until completing the 14 days post-exposure. That's very important. Some of the people who actually should be tested, again, everybody, regardless of signs or symptoms. But in addition to that, it's important if you have any sign or symptom that is suspected of COVID, please take the opportunity to be tested at any of those sites. Also, if you have a recent exposure to COVID, or you have been at a large gathering, and especially a place where a lot of people might have been without a facial covering or mask or poor social distancing, it's important to take this opportunity and be tested. I also want to say that all the specimens from this intervention will be processed at a lab that the federal government contracted for that purpose, but the result will be submitted to the Southern Nevada Health District. And having said that, also another thing that we want to emphasize is that if you receive a text message of any electronic communication from the health district asking you to get in contact with an investigator or contact tracer from the health district, please do not ignore that request, because it is very important for us and for the community to be able to initiate a contact tracing as soon as possible, because that way we are contributing to decrease the transmission of COVID in our community. Another thing that I just want to finalize is that, again, the use of mask, facial covering is extremely important, and we have seen a decrease in the transmission of this disease here in the last 4 weeks. Also, social distancing. We are glad that our community have incorporated that into their daily habits, and also we are glad that most of our business community have also been active participants on helping implement those measures here. And then, again, if you receive a communication from the health district, please respond to that and help us stop the spread of coronavirus in our community. And
Thank you, Dr. Ligon, and I want to circle it all back because I think that there are some very key points. So today is significant because we are the first community to actually ask to receive additional tests and get them. So we weren't forced to get them. But also, first and foremost, we got to thank the community. The community has really, this has been hard for a lot of us, including myself, but we have really stepped up as a community, and we are light years ahead of others because of all of the folks that are standing here today. We jumped in early. We set up initial testing, as you will remember. And we got into it very quickly. So we didn't wait for anybody because in Southern Nevada, we just made it happen because we have great workers. Secondly, testing is only one piece. So first, thank you to the community for doing your part. I can tell you today I got a report from the OSHA that said in the last week, 95% of Southern Nevada businesses were in compliance. So thank you for everybody doing their part. We also rolled out this week our contact tracing app, which is specific to Nevada. It was created by a Nevadan because it's very important that if you go get the test, that then the contact tracing goes right behind it, because we are trying to get at the source, because we know as flu season comes, we have to make sure that our hospital capacity stays on track. And we are in a very good spot with that today. So it's all of these things together that are helping our community stay on the road to recovery, stay to get us back to work. But first and foremost, we have to have a healthy community before we go much farther. So we have seen a decrease over the last 4 weeks, as Dr. Legon has said, and that's from your social distancing, that's from your face coverings, and that's really just doing your part when you're out and about. What we do want to remind people, and we're gonna say it 15 times, if you go to a large gathering, I say myself, if I haven't hung out with these friends for the last 30 days, I probably could go another 30 days. But if you have to go to those family gatherings, if you have to do all those things, this is an opportunity to have 60,000 additional tests in our community. Understand today that there's a lot of mixed messages out there on what we're really doing for testing. I can tell you we've been very consistent to test about 5,000 a day on a regular basis, just from the UMC and the public health component. And that is a big number, because there's not a lot of places around the country that are doing that. That's not counting our partners at the lab. So we are really working hard, and our numbers have already been up there. But to have the additional, most important thing that we're getting from the federal government is the resources. So Chief Steinbach he'll tell you any given time, our National Guard, our fire department is out there in 115 degrees. That's why we moved it inside, so we could get a little bit of reprieve for folks that were out there 8 hours a day trying to ensure testing. We've also spent the time, lab results were taking a little bit of time to get, so we've worked very hard to get our lab results back on track, so that we're within the 3 days, as close to 3 days, we're getting you that information. So the federal government coming in with their lab piece of it, that is good for us, so we can continue to do that. And this will allow options for people across Southern Nevada to go get tested if they want to, sure. So I will tell you, I put the contact tracer on my own phone, so I look at it at least once or twice a day. I myself have went and got the test, so I encourage people to be patient, go and get the test. We test the entire family, so you can bring the whole family and you can come and get tested. So just wanted to circle all that back, because we really have done a lot of amazing things in Southern Nevada. We have so many partners, and we have a lot of strong leaders in our community. And a lot of times we're working so hard that we don't stop to thank the people that are doing their part. So with that, we'll take any questions. None? We gave you all the information, so you don't need any questions? That doesn't happen, Shay. I know you have at least 2.
Money to kind of start the process. How long ago did you look and say, is this a viable option for us, and start those wheels turning in motion?
So the question is, this is the first time that the community grant is being awarded because we asked, and how long ago did we go to ask for those resources? Chief Steinbach, I know if you have more detail on it, but I can tell you we've been asking since day one. And we continue to ask, but I know you have more details when FEMA was here. Okay.
Thank you. So it's a federal program. We use the term grant pretty loosely, but it's actually a federal program that we were made aware of just last month. But we've been asking for additional resources since the outbreak. And whether those resources were PPE, whether the resources were additional test kits, whether they were additional personnel, we've been asking since our first outbreak back in March. But once we found out or were informed that this was available, which was last month, we said we would like that to come down to our community. We applied with the state. The state applies, further applies and asks. And to get that down here. And so we want to thank the state for their help with that as well. But to answer your question, last month we started asking. Oh, and as long as I'm at the mic, I just want to emphasize one point that I have forgot. When you do your registration, please put in a correct phone number and email. Dr. Legan's people have to get a hold of you, and many times we're finding that the phone numbers, most people are putting in the right information, but we are struggling with some incorrect information. It's only utilized for this one single purpose. Please put in the correct phone number. Help us help you with that. Thank you.
Question? So the question is, September 18th is when this, we have up until September 18th to utilize all 60,000 questions. And are we looking at extending it, and why are the locations chosen? I want to say the reason that we chose them was because they're successful. We've done it before at the Texas, at the Fiesta Henderson. St. Boyd is new to this, but we're trying to get across the valley, so we know that those locations work. Councilwoman Goins-Brown can tell you that the Texas was always super busy. People were sad when it went away, so this is a perfect opportunity for us to put it back. But those are the reasons those locations were chosen. Okay, any other questions? Shay?
Just to confirm,
That's correct. And so his question was, this is the highest amount of tests being performed in the shortest window. And the answer is yes. So we have been pretty consistent, staying above the 20,000 mark weekly, but this is actually with all the resources coming, which is super helpful to our teams who've been doing this for a while. This will be the highest amount in the shortest time, and we think that we can probably do this before September 18th, but we have the ability to do as much as possible for folks. So the question is, if we don't use all the tests, will they still be used in past September 18th? And the answer to that is yes. The tests will stay behind, but our goal is, we're 2.4 million people, so 60,000 tests is a small number. We know that there's still a want, and people are want to be part of the testing. So here's your opportunity to do it free and easy, drive through, and get that done. We tell them to rely on us local folks, but I'm going to let Dr. Legan, because we are taking a little bit different approach, but I'm going to let Dr. Legan, because we've always been of the mindset that as many people that can get tested for this, what we have available, but Dr. Legan probably has a more polished answer for you.
Thank you. Thank you for the question. Yeah, actually, it came up in the media, I believe, yesterday, and it has created probably a lot of controversies around the country. The reason for that is because today we know that about 25 to 40% of people who are infected by this disease do not show any sign of symptoms. So it's something that is important to keep in mind. So if we don't identify those who are asymptomatic and they are spreading the disease in the community, and we do nothing, well, we are missing opportunities. So having this intervention in our county today, where we have an additional 60,000 tests, help us identify a large number of those asymptomatics if they decide to come for testing. The second thing regarding this issue with the CDC is that related to contact tracing and the quarantine. As we know, those individuals who are identified as close contacts, the recommendation is to go stay home in quarantine for the next 14 days after exposure. During that period of time, it is not necessary to test the person because if the test comes negative, still the person has to complete the 14 days quarantine. Now, if somebody who is already recommended a quarantine because it's somebody who has no sign or symptoms, start developing signs and symptoms, now is a stronger indication for testing. But again, the main thing about this is that we have a strong interest in having everybody in the community that we could be tested, just because we want to be able to address that 25 to 40% of people without signs or symptoms that could be spreading the disease in the community. Okay, thank you.
Any other questions? Okay. With that, thank you for coming. Thank you to all my colleagues who came out today, and we're going to continue moving forward. So the more that you can encourage people to get out and get tested, the website is always faster. Do I need a test? Is that what it is? It goes faster for everybody. It is hot out still, don't forget. But please help us help our community get back on track and keep moving forward. So with that, thank you.